types of suicides. In this type of suicides, there are two types: egoist and anomic suicides, and reasons for suicides, common methods of suicides, preventional thoughts, and treatment. Uh, what is suicide? Suicide. It is defined an act with fatal outcome that is deliberately initiated, performed by the person in the knowledge or acceptation of its fatal outcome. It is a complex phenomena, means insurmountable disparity between expectations and outcomes, real or imagined, tremendous pressure on mind, building its logic, forcing it a conclusion of escape. Means the act of killing yourself intentionally to escape pain or suffering they are facing in their life. Types of suicide. Egoistic suicide. This type of suicide occurs when the degree of social integration is low. They feel they are outside or lonelier in this world. Example: people deep in depression with no future goals, one having feeling of worth. Second type of suicide, altruistic suicide. This type of suicide occurs when the degree of social integration is too high. They take their life for a cause. Example: a military service when a soldier expected to die for his own country. Anomic suicide. It occurs due to individual not feeling as he fits into the society anymore. This feeling is due to economic boom or industrialization. Examples: investors often commit suicide when they lost all the money they have invested. Fatalistic suicides. People commit this suicide when their lives are kept under tight regulation. They often live their lives under extreme rules and high expectations. Example: a man who kills himself before the police takes him to a jail. Reasons for suicide: poverty and inflammation, depression, loneliness, academic pressures for students, unemployment, feeling shamed or humiliated, physical health, problems with psychiatric patients and depressive disorders, trouble coping with recent losses like death of loved ones, divorce, etc. The common methods of suicides: pesticide poisoning, hanging, examinations, firearms, drawing and fatal injuries. Preventional thoughts. This is the main aim of this uh, presentation. Identifying high risk triggers or situations. Because by identifying them, problem you are facing, you can avoid them, we can have a plan or to solve them. Taking care of yourselves. By doing meditation, we can control anxiety and stress. Make time for the things that you bring you joy. Build your support network. Make friends and relatives will help us to have encourage and motivate us to live. Learn to deal with stress in a healthy way by offering hope. Avoid loneliness. Please be stay with people. Get treatment for mental health problems. Offering hope. As a friend to suicide attempted friend, you should have to motivate and encourage him to live. Treatment for psychological disorder patients who are attempted suicide. This can psychological treatment. This can help the suicide attempted people understand themselves and cope with their problems. Example: psychotherapy. Psychotherapy disorders are to be treated. Community therapy, problem solving and outreach. This is helpful for the people who have problems. Due to this, they are committing suicide. Interpersonal therapy. This therapy can change the relationship that cause depression. Example: if we have a problem with this relationship and we are trying to die for this relation, this therapy useful. And medication. Antidepressants are helpful by returning a person to normal functioning. Antidepressants are not habit forming. We should not use them regularly. Helping a suicide attempted friend. By seeking consultation, be supportive of counselor or doctor suggestions. Conclusion: suicide doesn't end the pain, it just passes it on to same else. Means it is not the permanent solution to escape from temporary solution, and we are giving his burdens and responsibilities to the loved ones. Thank you.